The Canadian Medical Association is urging the federal and provincial governments to work together to minimize the impact of Omicron. The organization says governments need to have a more clear, unified message because Canadians are being bombarded by inconsistent or contradictory news about COVID-19. The association recommends boosting vaccination rates, ramping up testing, and putting measures in place to bring kids back to classrooms. For more on this, we welcome the president of the Canadian Medical Association, Dr. Katharine Smart. Thanks so much for being with us. I want to start with talking about this latest report. It says the CMA believes Canada's healthcare system might be unable to recover from this latest wave. Talk about why.
It's so concerning right now what we're seeing in hospitals. You know, we have faced overrun hospitals now for months, and here we are yet again facing some of the highest and most rapidly rising rate of hospitalizations and ICU admissions we've seen yet. And this is, of course, on a backdrop of healthcare professionals who are exhausted, burnt out. And now we have that additional challenge of not having the staff we need to be in our hospitals because so many of them are directly impacted by Omicron or having been in contact with it. So we've really got a significant problem that we're dealing with acutely, and then the backlogs and how those are going to be addressed as they continue to increase as we move through this fifth wave.
Yeah, you talked about staffing. This is a huge problem that we've been talking about for weeks now. What's your response to what the Health Minister, Christine Elliott, announced today?
I think it's positive to see that Ontario is looking at mobilizing internationally trained nurses into the system to care for patients. This is an untapped resource, and we need really all hands on deck right now. We need to be able to provide care to patients who are needing our hospitals, and the issue with not having enough nurses has really come to a critical point. So I think this is a step in the right direction.
Okay, so let's talk about some of the recommendations the CMA is putting forward today. The first, of course, raising vaccination rates. So how do we do this?
This is definitely one of our biggest challenges. We know the vast majority of Canadians have chosen to be vaccinated. We're struggling with that final 10 to 15%. We're seeing the government, need to use stronger levers to motivate that portion of our population to be vaccinated. And I think that needs to continue, and all things need to be on the table. The other area we're really struggling is kids 5 to 11. We're heading back to school. We only have under 50% of kids in that age group with their first dose of vaccines. So we need to make sure that we're increasing vaccine confidence in parents, getting their questions answered, and getting those kids vaccinated.
Okay, let's talk a little bit more about how to get those people vaccinated who are still not and choosing not to get inoculated. Should we expand vaccine mandates? In some parts of the country, you can't even enter a liquor store without proof of vaccination.
Well, I think what we've seen is the vaccine mandates and the vaccine passports that have been put in place so far have been very successful at increasing vaccination rates. And just, recently in Quebec, as you mentioned, we've seen limiting access to things like liquor stores or cannabis suddenly quadrupled the number of people stepping forward to get their fourth shot. So I think we really need to look seriously at limiting access to non-essential services to motivate people to get vaccinated.
What does that mean? Here in Ontario, what would you recommend we do here in terms of vaccination mandate in schools? What about non-essential businesses, stores, hair salons? Should we be asking people for proof of vaccination for every one of those services?
I think right now everything needs to be on the table. It's very clear that being vaccinated protects you against being hospitalized and needing ICU. And right now we have a system that is not able to tolerate these ongoing surges. So we need to really do everything we can. And if that means making it very difficult to not be vaccinated by limiting access to those non-essential services, then I think that's something that governments need to consider.
Okay, also want to ask you about testing. So the Science Advisory Table now estimating that about 1 in 5 cases are being confirmed through testing. But again, that is just an estimate. So is it important to have more concrete numbers?
I think there's, two aspects of that. One is allowing us to actually monitor what's going on in the pandemic. And clearly we've lost the ability to use our standard approach to testing to do that. And we may need to be looking at other metrics to really understand where we are at with Omicron. I think the other piece is for individuals. I think it's very stressful for the public to have this rapid shift from being encouraged to be tested, now being told not to be tested. We have several things where it matters if you have COVID, if you're medically vulnerable and you may be eligible for some of the outpatient treatments for COVID-19, it's important to know that you have COVID. So I think we need to make sure that we have access for people where that diagnosis is critical for their medical care. And I think we need to continue to deploy and ramp up rapid testing for other Canadians who want that information and need it so that they can optimally manage their own health.
Okay, this is a really important point here because we're seeing a lot of that mixed messaging. We're also seeing a ton of misinformation really throughout the pandemic. So how can governments better address all of that?
Such an important issue. The misinformation issue has been huge, and it's been one of the biggest threats to health throughout this pandemic, and we're combating that on a daily basis. And I think you've really seen physicians and other scientists try to step up to offer appropriate and correct and accurate information to the public. And I think that's really critical. On the communication side, I think, what we're seeing is the challenge of multiple healthcare systems within one country, where different rules are being brought forth, different public health strategies, different rules around testing, isolation, what to do. And this leads to confusion. So I think there is a role for the federal government to try to pull the provinces together and for us to try to get on the same page about how we're moving forward in this pandemic so that it makes sense for Canadians.
And schools are such a great example of that scenario. Schools here in Ontario, of course, set to open to in-person learning next week. But then we've got kids in BC, Alberta, Saskatchewan. They're already back in classrooms this week. Katharine, should provinces have talked and had a more unified approach to education?
Well, I think it's just, again, one more stressor for parents. Parents are under a huge amount of pressure right now. I think there's a lot of confusion in the public, understandably, about whether schools are safe or not safe, whether they're sending your child to school is a good idea or not. And again, seeing this sort of potpourri of approaches, I think just leads to that confusion and decreases confidence in the messaging that people are having. So again, it's never going to be perfect because, of course, we do have different provinces and territories that manage their own education and healthcare systems. But I think the more we can try to align on what makes the most sense, what's grounded in the evidence we do have, and try to move forward with some basic principles that are united, I think it's going to be clearer for Canadians and right now, especially for parents and caregivers.
Okay, so let's talk about moving forward. I think that's what a lot of people want to do right now. But what happens after Omicron? I mean, are you concerned about another variant?
Yeah, that's, of course, the important question. And I think we, of course, don't know what's going to happen after Omicron. But I think there's absolutely the ongoing risk of new variants. And that brings us back to one of the other things we're talking about today in our statement, which is the need for global vaccine equity. We know that many people in the world have not had the opportunity to have access to vaccines. We know that that is both, wrong from a moral and ethical perspective of them being disproportionately impacted by COVID. But it's also a risk to the rest of the world, because that is a hotbed for new variants to potentially form and spread yet again around the world. So I think that message that no one is safe until everyone's safe is true, and promoting and encouraging and providing vaccines to the entire world so that everyone can be safe is critical for public health.
Okay, and Dr. Smart, there is understandably a lot of pandemic fatigue. What's your message to people about following these public health measures, especially when you live in a place or a province that seems to have much tougher restrictions?
I think there's no question that everyone is over this pandemic, and no one is more over it than healthcare workers. Right now, given where we are, I think we really need to ask Canadians once again to pull together to see us through these next few weeks that are going to be very challenging. And really what happens next, we need to count on Canadians to limit their social contacts, to get those booster doses, to be vaccinated if they aren't yet, to wear high quality masks, ideally respirators when in indoor spaces, so that we can blunt this curve, keep our healthcare system operational. So to everyone who's doing that, I just want to say thank you. Most Canadians, the vast majority, are behind us. I know they're doing everything they can to keep the healthcare system safe. This is going to end eventually, but we just need to hold on and pull together a little while longer.
Okay, a great message of optimism. We'll leave it there. Dr. Katharine Smart, thanks so much for your time tonight. We appreciate it.
Thanks for having me.